Hi, I'm Awojoodu from the National Minority Equality Forum, and this is For Your Health News. Your health, your news, your power. And I'm here with the powerful Tony Awojoodu. Nice to meet you, Tony. Could you introduce yourself?
Yeah, my name is Dr. Tony Awojoodu. I currently lead hospital partnerships with DaVita. I also am the founder and CEO of a life coaching company called Tones Professional Advisory Solutions and Services, which is a mouthful. But in a nutshell, I help underrepresented minorities discover their purpose, develop professional strengths, and deliver generational wealth by learning how to invest.
My goodness. How do you do it all? I mean, first of all, congratulations. Tony is part of our 40 under 40 class of 2025, minority leaders in health. Yeah. And it sounds like you're hitting both in the professional, in the corporate space at DaVita, as well as through the personal with lifestyle coaching. So why is that important for you to have that balance?
Yeah, it's a great question. A lot of people look at all the things I do and feel like it's a lot, but there are a lot of common themes and integrations across the things that I do. Mm-hmm. My life purpose, I believe, is to serve people and help bring about the best in others, and how that manifests might differ in the work that I do in my day job at DaVita and with my business through Tones Pass. But it's really about leveraging my skills, my experiences, and my network to help people live the fullest and best versions of their lives.
Can you share a little bit more about DaVita, what the company stands for and what they do?
Yeah, so DaVita is a kidney care company. Traditionally, we do dialysis. So our bread and butter is helping people with kidney disease continue to live. When you're diagnosed with kidney disease, there are three fates. You live the rest of your life on dialysis, you get a kidney transplant, or you unfortunately expire. So our patients unfortunately have end-stage kidney disease, and we help them live as long and full lives as they can by getting multiple times a week dialysis treatments, either in our centers, at home, or in hospitals.
Dialysis centers are increasing across the country, particularly in urban areas where, communities of color tend to be concentrated. What do you think is the explanation for that? I mean, what does the data say about that?
Yeah. So about 1 in 9 Americans suffer from kidney disease. And one of the most challenging aspects of kidney disease is it's a silent disease. You don't know you have it in many cases until it's too late. And many of our patients discover they have kidney disease when they're hospitalized and dealing with fluid overload, and their body's essentially poisoning themselves because their kidneys have lost the ability to filter out the toxins that naturally metabolize. So a lot of us suffer from it, and very few of us know about it. In the Black and brown communities in particular, it's overrepresented. So African Americans in America are about 4 times as likely to suffer from kidney disease as white Americans, and it's close to, I think, 2 times as likely for Hispanic and Latinos. So it is a true public health epidemic, and the things that are leading to a higher incidence of kidney disease are lifestyle, treatable and avoidable things. So, high blood pressure, diabetes. In general, when you have populations that aren't being thoughtful about what they eat and how often they exercise, just taking care of their body from a primary health standpoint, you see a greater incidence of kidney disease. So unfortunately, a lot of the stuff that's going on in kidney is avoidable, but we have poor healthcare literacy in many of our geographies, and that leads to a higher incidence.
So let's talk about you said it can be avoidable, it can be preventable. Is that where the integration comes in with your lifestyle coaching about our own lifestyle choices and what we can be doing to prevent becoming at risk for kidney disease? Yeah,
there isn't a direct linkage between kidney disease and my life coaching business, but the general linkage is, you can't serve others if you're not serving yourself. So a lot of people come to me and say, hey, interested in a job, can you help me work on my resume and land my dream job? And the first thing I'll say is, are you good? Right. What that means is, do you know your purpose? Do you know the drivers of your happiness? Are you taking care of yourself? Because if your cup isn't full, you can't pour that cup out for anyone else, whether it be an employer, a partner, family, et cetera. There's some general themes around paying attention, listening to your body, getting your regular checkup, getting your labs. If you're pushing 40 like I am, proud to be a 40 under 40 honoree, getting that colonoscopy. I very commonly talk to my clients and friends and family about the importance of just listening to your body and getting those preventive measures in, so you can get far ahead of some of the diseases that we know exist at higher rates in our community.
I'm about to call you Pastor Tony, because you were preaching just there right now. Why do you think our communities, maybe we don't prioritize our health? What is the reason for that you've seen?
Yeah, I mean, when you think about diseases like kidney disease and hypertension, diabetes, that are the most, challenging long-term chronic healthcare conditions that have significant cost, quality, and outcomes impacts here in America. And if you superimpose those diseases on the communities where they're most prevalent, these are communities where people have to work, oftentimes multiple jobs to make ends meet. Living in multi-generational households, living in communities where there isn't great access to healthcare, and even if there was, uninsured and underinsured patients where the question of who wants to take on the burden, the cost burden of their lives is left unanswered. What happens is these healthcare needs just are left unmet. So the reality is the people that are most impacted by diseases like kidney disease don't have the access to healthcare, don't have the education around what they need to be looking for and asking about. In many cases, just don't have the time, right?
Right, don't have the time.
You have to work 3 jobs to make ends meet. You don't have time to go to your primary care physician to get that checkup. And if you do have the time, that's taken away from your ability to, get that paycheck and take care of yourself and the family. So, I mean, it really is a combination. It's a multifactorial challenge that is, incredibly hard to overcome.
We know about the systematic barriers, but some of the things you mentioned sound like things that maybe we are in control of ourselves. You mentioned time. We don't have the time, but you are an expert in time management.
That's right.
So what would you say to our viewers, about how they can take control of their health today with maybe just the practice of time management? What kind of tips would you give?
Yeah, it's a great question. 2 tips. Set the expectation for 1 and proactively plan for 2. On setting the expectation, it's one thing to say, hey, it's important for me to go to my PCP and get my annual, visit. It's another thing to share that with your partner, share it with your children, share it with your employer, and make sure that you're creating a space, an environment around you where everyone else around you knows that that's important. So if you need to call in and take a day off or just have your partner take care of the kids for that half a day session, that expectation set on the front end. And regarding proactivity, it is much easier to put something on your calendar 6 months down the line and protect the time than to start scrambling when you start feeling, uneasy or unwell. So I just strongly encourage people from a health standpoint, schedule these things out far in advance, put it on your calendar, protect that time, and make sure you're doing all you can to honor it.
Yeah, because not everybody has a partner, right? Or maybe an employer that would be understanding, unless you've asked that for that time months prior, right? That's very hard to deny. When it comes to general health, what have been the top, causes or problems that you've seen that could be easily preventable for our communities? What are the things that you would say should be prioritized in as far as awareness campaigns and such that we all need to be more cognizant of?
Yeah, I mean, the biggest thing is diet. Right. There's a phrase that we've all heard, you are what you eat. But if you actually think about
So I'm chocolate. That's what you're saying.
You and I both.
And I'm chicken. Okay. All right.
I have vices myself. I'm terrible with sugary candy. So, I work it out on the back end.
Okay.
Right? I'm not going to sit up here and tell you I eat the best in the world because I don't. But I mean, there are, if you look at in the zip codes that are most impacted by significant health challenges that our nation is facing, you don't see access to fresh food. You don't see access to healthy food. It's, heavily processed. There's fried foods, it's fast foods. The cheaper it is, the worse it is. And it takes time and effort to go out of the way and get access to food that's actually going to serve the body in the way that it needs to be served. But it's important, right? If you take years and years and years of terrible eating, that compounds in the body and you are what you eat. So I think the easiest thing to start to shift is your diet, your nutrition. What are you putting in your body? Is it the right stuff? And can you get access to healthier food? Second thing I'd say is how you exercise, right? And exercise doesn't always mean you're running marathons. Sometimes it's meditation, which has physical and mental impacts on the body. Just, walking instead of driving or taking the stairs instead of taking the elevator. Some of these small decisions compound in a positive way over time. And that, I'd say, represents 80% of the controllable factors in many of the chronic diseases that impact our nation today. So be mindful about what you eat and put in your body, and be intentional about creating spaces at least 2 or 3 times a week to work out.
Wow, that sounds really easy.
Easier said than done, but it's not rocket science.
Right, it's not rocket science.
The question is, can you create structure and consistency around it? And the answer is oftentimes no.
Right. If you are okay with your own health, but our community is generally sicker than it should be. Yeah. How could we, in our capacities, also become superstars like yourself? And what can we do to help our communities become more healthy? What can we be doing to advocate for people that look like us and for our loved ones?
Yeah, common knowledge is one of the most powerful forces in terms of change, right? There were slaves that didn't know that they were freed for, years, right?
Wow.
And were still living under bondage for many years simply because no one told them.
Right.
So that's a bit of an extreme example, but removing the taboo around talking about health, the stigma around even mental health services and, psychology, psychiatry, there's so much need in our community that is left unmet because people aren't willing to have the conversation around it. So I'd say regardless of where you are in the health spectrum, from incredibly unhealthy to incredibly healthy, as we all become more comfortable having those conversations with our friends, our partners, our families, our employers, our community members, it destigmatizes, the conversation that currently is stigmatized, and allows people to start, questioning, well, am I actually well, or can I explore something that my brother, my sister, my friend is doing that maybe I could benefit from? I just haven't gotten that access yet. So
normalize incredible health.
Yes.
Sounds like a great hashtag.
Talk about it.
Okay, wonderful. Tony, what would you say to your other members of your class of the 40 under 40 during these times when there is a ton of misinformation, confusion? You talked about hope as well. And right now, folks can feel a bit beat down, with what's going on. What would you say to your peers about what we could be doing in the face of this? And then what would you say to our viewers?
Yeah, loaded question. I can answer a lot of ways. And in this particular season that we're in, with all the changes in the administration, I can understand why people would lose hope. And there's just a lot of uncertainty and a lot of anxiety around how our community will be impacted, and particularly from a health standpoint, as some of the changes and reductions are happening in the federal agencies that for generations have supported underserved and underrepresented communities. So it's a simple challenge, but the challenge I'd leave to my co-fellows or co-honorees is to stay the course, right? Mm-hmm. We're all here for a reason. And even just today, meeting other NMQF honorees, it's been inspiring to hear what they're doing and to be challenged to think differently about my own role. So stay the course. On your most burdened day, just know that you are not an island. It might feel that way, but we're all collectively solving these problems together. And I'm encouraged to know that I now have a new group of people to tap into, and I hope that we can all stay in touch and continue doing great things in our different lanes.
Thank you so much. Appreciate your time.
Yeah, of course. Thank you.